Welcome everyone to our webinar, Theoretical and Practical Gaps in Integrating Green Infrastructure and Public Health. So today we're joined by Dr. Konstantinos Tzoulas, Senior Lecturer in Environmental Management at Manchester Metropolitan University. His research interests include urban ecology, sustainable development, green infrastructure planning, and public health. And Costa is currently evaluating the social and economic aspects of carbon farming and recently worked on evaluating the wellbeing benefits of urban parks for people with early stage dementia. In this webinar, Costa will discuss how urban green infrastructure can make significant contributions to physical, psychological, social, and economic determinants of public health, and how, in order to overcome theoretical and practical differences between disciplines, innovative, transdisciplinary, and systems thinking approaches are necessary. As always, there'll be the chance for questions at the end of the presentation, so please do submit these in the Q&A option at the bottom of your screen at any point during the presentation, and then I'll ask these on your behalf later on. So thank you for logging in, and I'll now hand over to Costa.
Thank you very much, Daniel, and the Institution of Environmental Sciences for inviting me. And also thank you to the participants who are joining this webinar. I'm Costa, like Daniel just said. I am an environmental manager and specializing in urban green infrastructure planning. I'm particularly interested in interdependencies between social and ecological systems of green infrastructure. So this is what this webinar is today about. What we're going to do is going to have a broad overview of our essentially conceptual understanding, as well as some of the practical and theoretical gaps that there are in linking, as I say, social and ecological benefits, and particularly in identifying win-win situations in planning urban environments. So we start with an opening question. Is choose the odd one out? And I would like Danielle to, oops, sorry. To start the poll.
Yeah, so the poll should have started now. I'll give you about 30 seconds or so, if that sounds okay.
Super. I think this is fantastic. This is a fantastic list of participants we have there, because most of them got it right. Could I ask one of the participants who answered B to type in why they think this is the odd one out? The other determinants can be changed. Okay, good. We've cracked. This was pretty too easy. So yes, you're correct. Remember, this whole context is about green infrastructure and contributions to public health. So we're thinking about determinants of public health that have an influence, or that green infrastructure has a direct or indirect influence on that particular determinant. So certainly green infrastructure can have an influence on where people work and live, on those conditions. Certainly green infrastructure, the global economy and the global biodiversity are aspects that are affected by and also affect green infrastructure planning. Basically, this is the only thing that green infrastructure doesn't have a direct link with it. So obviously, green infrastructure, contact with nature will not affect people's age or sex. Having said that, it will affect, contact with nature will have an effect on some hereditary factors of public health through land contamination. So if we if I manage to move to the next slide. There. So this diagram here is a known diagram within the public health sector. It kind of outlines the socioeconomic and environmental determinants of health. What this is important from a green infrastructure planning perspective. Why this is important from a green infrastructure perspective is that it identifies the potential multifunctional contributions that green infrastructure can make. And the point of the previous exercise was that, in fact, if I introduce you to this diagram here, this diagram essentially combines the green infrastructure components of the urban environment with the ecosystem functions and processes, and then all of these combined with the various aspects of health. Because again, remember, health, we're not talking about the absence of disease, but rather we're talking about the whole set of determinants that influence health and well-being. So in other words, health, it's got economic, social, biological, as well as psychological components. And we can only consider health, well, obviously in public health terms, in that integrated way. So in terms of components, we have quite a lot of evidence about how it's one of the black boxes, if you like, or of the gray boxes within each one of the big black boxes works. In terms of linking, particularly linking green infrastructure to socioeconomic determinants of health, these potential mechanisms here, or this body of evidence here, suggests mechanisms that relate to economic contributions of green infrastructure in terms of hedonic values, how people behave in terms of where they invest their money or spend their money. In terms of social contributions, again, a lot of evidence about green infrastructure contributing to identity, belonging, opportunities for participation in local community, governance. These two sets, again, there is increasing evidence in both. This has got to do with the physical health. A lot of evidence about cardiovascular processes, cardiovascular effects, endocrine system, some cancers, colon cancer, breast cancers, in terms of recovering rather than in terms of prevention. But the cardiovascular and endocrine effects, there is evidence for both prevention as well as some kind of treatment effect. And obviously the psychological components, stress, attention. Stress has got to do with a whole set of hormones. Attention has got to do with cognitive processes within the brain, and of course, preferences, what people like or dislike. So in other words, there is a lot of evidence about particular components of the whole equation. So this is good. This is the product of reductionism. Keep that in mind. We will come to this. That allows us to collect evidence to say, for example, what that particular box tells us, but not necessarily what the interconnections are. Having said all of that, obviously we have started accumulating evidence. There is evidence about some of the interconnections, because still at this stage here, things are quite abstract. We need to have a particular mechanism ideally that goes from the outside of the individual to the inside, which affects the health. So we have started identifying some of those mechanisms. Stress reduction, attention restoration, the built environment, which is a big factor obviously in urban areas, physical activity, self-perception, place identity, community mechanisms, care provision. This is in fact the biggest, if you like, determinant at the moment, because we're following a medical paradigm where the emphasis is on treating the disease or the illness rather than preventing it from happening in the first place. So that's the medical model, the care provision, and then ecological factors. So each one of those mechanisms can increase or decrease stress. And as I say, we can measure stress in people, and we can measure particular connections or mechanisms between each one of these boxes and stress. And then that stress, if it increases, it causes chronic inflammation. This has got to do with the endocrine system. So again, we have specific links there. And then this is where things start becoming less certain, if you like, where from chronic inflammation, yes, you will get some ill health, but obviously you don't know exactly how or what might be or how much of it. So this is good in the sense that we do get some of the interconnections identified. These two sets of understanding, if you like, this, which is essentially what's happening outside the individual or very nearby them, and this which links the outside with the inside and the particular or potential ill health. So this is all good, but you will notice we have a lot of this evidence here. But if you notice here on the components of the different, if you like, social and ecological systems, we have quite a lot of evidence. But here we have some of the evidence. So this is an emerging field of evidence, and this is certainly where we need more knowledge to be developed, both empirical as well as theoretical, to quantify, if you like, the interconnections that we see between these and these, between this and this and this and that. So obviously, this is interdisciplinary work. There are various initiatives that allow us appropriate settings to test some of those potential hypotheses. These are all different initiatives that link, if you like, contact with nature or some kind of interaction with the ecological environment, you know, plants, animals, green spaces, wilderness, urban parks, whatever it might be. And initiatives that are general for the public general or for particular types of diseases. And in fact, for dementia walks, we've observed for a year 2 different dementia walks. So all of these initiatives in this box in the middle, they are opportunities that allow us to study or to measure in setting those potential mechanisms. Good. So in other words, we have, if you like, all the basic knowledge or a lot of the basic knowledge or basic theoretical understanding of how we could link social, ecological, environmental, biological outcomes or factors that affect health. Good. Next question. And then you can type in to the chat room what comes next in the sequence. We're going from about this time all the way to now. Reductionism, holism, what's next? So one person said systems, close enough, but not, it's missing something, systems, what? More of the participants would like to suggest. We have one answer that says systems. That is interesting to hear.
Yeah, there are a few people that have come through in the chat box as well. Someone said minimalism, planetary health. Someone else said globalism.
Okay, good. Keep them coming. Keep them coming. They're close, but not quite there. Dynamism. Good. Good. Okay, so this is very interesting. Yes. I'm afraid close questions, but not quite there. Okay, so I will get you from the beginning. In terms of understanding the environment around us, and obviously this has happened, and abstracting the complex world around us into ideas and symbols. Obviously, this happened hundreds of thousands of years ago, but at least the earliest evidence that we have on a bit of stone, actually, which are abstract symbols. So that goes back to them. Now, in terms, obviously, between that and then, there are various paradigms, obviously, the ancient Greek or the Buddhist or the Sanskrit or the various other paradigms of knowledge, Egyptian, whatever, Indian, American, Indian, whatever it might have been. But what we're interested is here. We're all familiar with reduction in the importance of analysis, and most of science is still very much based on this paradigm, reducing the complexity, breaking down the complex world around us into systems that we can focus on and study. This is a paradigm, and we're all familiar with this, and many of the answers that you are sending back relate to this. Holism is the general systems theory, where it says we should, the sum is, the whole is greater than the sum of the parts. It says that we need to identify interconnections between the different components that have been broken down there, identify the interconnections, and general systems theory, every system is interconnected with another one. Fine. Now, essentially though, what this is reductionism on steroids, as I like to think it. It's the same belief that the environment around us it works like a clockwork, that if we're able to break down the different systems and we're able to model them very accurately, then we will end up with systems that can predict environmental impact, they can predict social conditions or environmental conditions or economic conditions, they can predict health outcomes. So this is the belief here that modeling, and the more modeling, that modeling is actually an accurate representation of reality, or indeed recognizing that modeling has got limitations, but it's good enough to tell us how reality works. So all of this relates to general systems theory. It's all about interconnections, it's all good, but it still is very much predetermined about probabilities. Now, this is the next paradigm, the emerging paradigm, which I'm trying to move my slide. There it is. Systems thinking paradigm. And be careful of the similarity. General system theory belongs here. Systems thinking paradigm is a whole new paradigm with distinct characteristics from both of the previous paradigms. Now, the emphasis here is very much on resilience, is very much on adaptive management, is very much on emergence. Emergence is about unpredictability and uncertainty. It's not about probabilities, but it's about possibilities. So this pushes us to learn about the things we don't know. It's uncertainty. Uncertainty is what drives us. So systems thinking paradigm is what comes next. Here, the emphasis is on interconnections. This leads to trade-offs. Here, the emphasis is on interdependencies, which necessitates win-win between different socio-ecological systems rather than this paradigm of trade-offs. And we're all within the environmental sector, we're very familiar with the trade-offs. So that's in the context to explain what's the biggest gaps that we have at the moment is. And the gaps that we have is any system around us is a socio-ecological system. Any green infrastructure, any bit of land, any bit of urban area is a socio-ecological system. The Amazon is a socio-ecological system because human societies affect what happens in their environment and they are affected by it. Now, within an urban context, when and essentially every socio-ecological system will have internal and external components that interact across various spatial and temporal scales. The problem is that when we try to design green infrastructure components or design any societal component, then we focus on particular systems. We prioritize particular systems at the expense of the interconnections with other ones. Obviously, we will make some interconnections, but they will be limited. And this is where the problem is. The problem is that we don't identify all of the potential socio-ecological interconnections of planning an area or planning a product or planning a process. We don't identify all of the socio-ecological connections. We identify those that we define as priority or most direct ones. And obviously the reason for this is we have in disciplines, different disciplines, they tend to focus on their understanding of the world from their own perspective. So obviously every discipline will have their own language and different measurement, different operations, different practices, fine. But also is how we value. These have got to do with normative understanding of the world around us. The environment, the ecological side of the equation, it doesn't just have one set of values. It's got relational values. Every community will have a different relationship to it. This is what we need to realize. The same with defining multifunctionality, as I say. If we think it through, then every socio-ecological system should have the same kind of aspects, socio-ecological aspects, because it's all the same, they're all part of the same continuum. But it's identifying those functions and defining them in terms of social outcomes. Now, transdisciplinarity is another problem. Usually, sciences tend to define problems within their disciplinary perspectives. Science, policymakers, and the public are seen as separate components of managing the environment. Whereas, in fact, for the knowledge, for defining what a social or a public health problem or an ecological problem is, we need to engage the scientists, the policymakers, and the public. It's that co-definition, co-development, and co-management of problems. So defining what the problem is, developing the solution, and then managing the solution. And transdisciplinarity obviously goes hand in hand with polycentric governance. Ecological systems have got a variety of direct and indirect benefits that belong to everybody. They don't just belong to the people or organizations who own the land. So it's about engaging local communities, truly engaging them in decision-making that affects their immediate living conditions. Now, all of this, the result of all of this is that we tend to see things in a fragmented way. And even if we're trying to identify the connections, what we're missing is that win-win situation. Even if we identify connections between social and ecological components, we define them in context of a trade-off and say, okay, we will have to sacrifice either the social or an ecological component for something else. But as long as we keep doing that, then we're creating problems for the future, because we're talking, as I say, about interdependencies, and it's only out of our narrow definition of the context, the scope of our actions, that we don't see the bigger picture or the bigger two-way interdependencies. Now, there are ways for integration, obviously. Ecological public health emphasizes that health is about the conditions, is about society, economy, and the environment. Most of you will know that sustainable development is also about those conditions, and obviously initiatives like the Healthy Cities initiative that's going on for 30 years now globally, which is all about identifying those broad interconnections between social, ecological, environmental, biological, ecological, environmental components, rather than separating them. But any of those integrative paradigms, they cannot stand alone without a socio-political economic shift to a circular economy, where the emphasis is not so much on the quantitative profit making of the economy, but rather on the qualitative continuous provision of services rather than of products that go through the linear process, and where the loops are closed with no waste in whatever form it takes, and no extraction again from the environment, or obviously these are very absolutes, but at least with minimal wastes and minimal extraction. So a circular economy is absolutely fundamental in underpinning ecological public health. And you know, the point that I'm making here is one fits the other, and we cannot have one without the other. Now, final thing to point out, a whole host of existing practices, different ways, implementation strategies or approaches that there are for start making those, for identifying those interdependencies. Remember, the point that I'm making is we know the interconnections. We need to move forward to focusing on the interdependencies, moving from trade-offs to win-win situations. So these are all special approaches to integrating the natural environment with the built environment. They all about mimicking, if you like, nature, or allowing ecosystems and ecosystem processes to do most of the job that now gray infrastructure does, or artificial infrastructure does. And then these are all processes here that allow similar approaches in the economy, where they mimic natural processes, they close the loops, they minimize the waste, they minimize the extraction side of things. But as I said earlier, these are wicked, multifaceted, complex problems that no one discipline can claim full understanding. So we need co-definition, co-production, and co-management of those planning approaches, of those design production approaches, process approaches. We need to engage the scientists, the policymakers, and the users of those, the general public. And of course, in environmental impact assessment, various tools that the ecosystem services approach and the ecosystem approach could be incorporated. Ecosystem services approach, it emphasizes those socio-ecological connections and that integration in terms of adaptive management. There are tools that could be used at the national level, over here on the left-hand side. There are tools that could be used at the environmental impact process. There are tools that could be used in the management of organizations, in environmental management. So we have tools that allow us to identify those connections. What we need is moving beyond trade-offs and more towards win-win between factors, between socio-ecological components, rather than promoting that trade-off situation. And that's about it. That's about it. There are some suggested resources there. If anybody would like to contact me, check the details at the bottom. I'm happy to answer questions.
Brilliant, thank you. That was fascinating. And as Costa just said, if you have any questions, please do just submit these via the Q&A option at the bottom of your screen. We do already have a couple of questions in, Costa, so I'll just read these to you. So the first question, okay. Are there any examples of this being implemented in cities?
Okay, of this, I think, of what the answer is yes. There are examples of anything. Of I think that question came here in the front. So I will answer to this by showing you this slide here. So healthy cities as an initiative and sustainable cities, they bring together social, economic, environmental components. So healthy cities and sustainable cities, what they're doing is they're institutionalizing, if you like, this conceptualization of nature. So yes, and there is a lot of overlap in those initiatives, healthy cities and sustainable cities.
Brilliant, thank you. Someone else has asked if there are any infrastructures that are centered around pet therapy.
Pet therapy. Well, infrastructures. There is a pet therapy as an initiative in itself. Infrastructures, there are farms who provide opportunities for pet therapy. There are, rescue centers that do that. If you mean that by infrastructure, then yes, there are, in the sense, as I say, there are particular places where you can go and do it, as opposed to just getting a pet and having it in your own house. But not a wider kind of infrastructure, as in public parks infrastructure, for example. But there are, as I say, there are farms and rescue centers who do that.
Great, thank you. We've got a few more questions, so we'll try and get through those.
Yes.
Someone says, you've separated the natural environment which we can visit from the man-made environment in which we live. Do you think that there needs to be more emphasis or an equal emphasis on the architectural hard environment that we are given to live in?
Yes, certainly. This is the built environment component there. There is a lot of evidence that the built environment, what is outside in between buildings, and obviously what is inside buildings, the sick building syndrome, things like that. But I'm more interested in the outside of buildings. So there is a lot of evidence that built environments can have negative consequences on health. And this is the whole point, that by ameliorating that with green infrastructure, by introducing that natural component, then you're ameliorating, in fact, and as I say, all of these components here. Green infrastructure is about multifunctional green space systems. This is about green spaces targeted to particular problems, flooding, carbon sequestration, whatever it might be. Ecological engineering is about recreating or restoring damaged habitats or ecosystems. This infrastructure ecology is about energy infrastructure, telecommunication, the infrastructures, transport, this type of infrastructures where you go along those and you put green ecological elements in them. Greenways, again, they are planning approaches focusing on recreational or on ecological components. So yes, there is certainly a big emphasis on reducing the modification of humans on ecosystem and ameliorating that mitigation by introducing that ecological component in cities.
Great, thank you. We'll just maybe do a couple more. So someone said, wants to know how climate change and the increase in temperature and the frequency of heat waves could impact the green infrastructure planning strategy.
It depends where you are in the world. Here in the UK, it is about planning for drier, more not that it's going to become desert, but plants that can withstand periods of dryness, and then they can withstand periods of wetness. So it's, like I say, there is so much uncertainty with any aspect of planning in relation to climate change, but in terms of urban park planning, the discussion is about, can you use the green infrastructure to mitigate the flooding problem? Can you use it to mitigate the urban heat island effect? And can you make the green infrastructure to withstand both of those extremes in terms of wetness and of dryness? And in fact, in our project, when we looked at the private gardens here in Greater Manchester, we had seen a big influence both on the urban heat island effect and on flooding by adjusting green infrastructure. But you're right, the planting needs to be so that it can withstand whatever the conditions will be.
Great, thank you. We'll try and get one more in. Someone said, greening the urban environment, for example, planting trees, requires space and investment to allow the trees to grow. However, this is often not done well due to the short-term additional cost. How do you change the mindset of developers and planners to place greater value on the long-term benefits rather than the short-term costs?
Yes, and this is why I say we have to be moving to this circular economy paradigm, because all the odds are stacked against under the current neoclassical model of economy, where the emphasis is on profit. We have no chance of convincing any developer about long-term benefits. When we're talking about qualitative aspects, then there is a better argument or potential argument to be made there. So that requires a bigger societal and economic change, if you like, rather than just trying to convince. In fact, at the moment, the concept of natural capital and ecosystem services has been used, where you try to put a monetary value on those ecosystem services. And then you say to developers, look, this is actual money. But even that approach isn't solving that answer, because obviously a developer might make more money by developing.
Exactly.
So yeah, this is one of the holy grails, but like I say, that requires a different definition of what values we put on the economy and how the economy works.
Brilliant, thank you. We do have a few more questions, but I'm conscious that we have run over.
Okay.
So I assume people can contact you directly if they...
Yes, certainly. Here is my email there. Happy to answer any further questions.
Brilliant. So thank you again for presenting. That was really fantastic. And that's it from us today. Thank you everyone for logging in. If you're an IES member, don't forget to record your attendance in the IES CPD tool. And you can do this by logging into our members area. Today's webinar has also been recorded and will be made available on the IES website and the YouTube channel. So if you're watching the recording on YouTube, please subscribe to our channel and like the video and hit the bell to gain notifications of new content. And our next webinar will be on the 11th of February and will be on OJA assessment toolkits. Again, this is free to attend, so please do visit the IES website to register. So just thank you again to Costa and to everyone else. Thank you for watching.